Assalamu alaikum, Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right segment where we have a BTR in the upper right 5 and we've got a infected upper right 6 which has a crown prosthesis on it. On the panoramic view, you can see that there's a periapical radiolucency under the 5 and a periapical radiolucency under the 6 as well. Now, the upper right 5, we're going to show you the transaxial view. The transaxial view basically shows us the proximal view. The proximal view, you can see that this is the BTR present. The BTR is non-root canal treated. We've got a periapical radiolucency associated with it. Now this region, if for implant placement, we've got 9 millimeters of ridge width with approximately 19 millimeters of ridge height. Our doctor has both options in this case. We can either place an immediate implant after extracting this and can engage in the palatal and the apical bone, but for this you need a longer implant. And the second option is doing a extraction and grafting and placing an implant at the later, which is more beneficial as the tooth on the distal side, which is the upper right 6, has a severe bone resorption. This is the mediobuccal root. You can very clearly see they've got periapical radiolucency, you've got perforation of the cortical plate, interradical radiolucency is also present. As we are moving towards the palatal root is fractured, as you can see very clearly right here. We've got fracture in the palatal root, which is leading to the interradicular infection. We've got resorption of the palatal root. We've got a perforation of the palatal cortical plate, and we've got sinusitis as well. So overall, this tooth is doing not very well. This you've got a radiolucency in the interradicular, and here you can also see we've got palatal, distobuccal, and interradicular radiolucency present here as well. So this tooth needs to be extracted and this region needs to be grafted because an immediate implant placement in such an infected and in such a ridge is not going to be possible. So if you have any further questions regarding this case, please feel free to reach to our team. We would be extremely happy to help. Thank you very much.